Our final witness is Michelle Bishop. Ms. Bishop is the Disability Advocacy Specialist for Voting Rights at the National Disability Rights Network, where she's responsible for coordinating voting rights initiatives in every U.S. state, district, and territory, as well as providing training and technical assistance to the nationwide network regarding voting rights and access for voters with disabilities under the Help America Votes Act. Ms. Bishop received her Master of Social Work and Social Economic Development from the Brown School at Washington U in St. Louis, and a Bachelor of Arts in Sociology and English Literature from State University of New York at Genesco. Ms. Bishop, you're now recognized for 5 minutes.
Thank you for the opportunity to testify today representing the National Disability Rights Network, or NDRN, which is the nonprofit membership organization for the federally mandated Protection and Advocacy, or P&A network. Social distancing is our best line of defense from the threat of COVID-19, and naturally vote by mail is a critical piece of the puzzle for keeping elections safe during the pandemic. It behooves elections administrators to allow for as many voters as possible to choose voting from home for their own safety, as well as the health of their fellow voters and elections personnel. Reducing in-person turnout in 2020 is unfortunately necessary to enable in-person voters to properly social distance while voting and allow poll workers to sanitize between voters. Therefore, now is the time to relax deadlines for request and return of mailed ballots. Now is the time to eliminate barriers like requirements for doctor notes, notaries, and witness signatures. These extra hoops to jump through pose a health risk for voters with disabilities, and particularly those that are immunosuppressed, who are under stay-at-home orders or in quarantine, that must then break their self-isolation to access doctors, notaries, or witnesses simply to be able to vote. Even with these measures in place, it should be noted that traditional vote-by-mail systems are not and have never been accessible to voters with disabilities. People who are blind or low vision, have print disabilities, limited literacy, limited manual dexterity, and other disabilities cannot privately and independently mark, verify, and cast a hand-marked paper ballot. States that have not already done so must immediately implement some form of electronic ballot delivery or remote accessible ballot marking system that provides an electronic ballot to voters who choose to vote from home. These technologies are widely available and have been in use reliably for years in primarily vote-by-mail states and for military and overseas voters. When vote-by-mail systems are not made accessible for voters with disabilities, we in essence ask people with disabilities who are considered the most vulnerable under COVID-19 to be the only voters who take to the polls and assume the personal health risk of in-person voting, while their non-disabled peers have the privilege of voting from the safety of their homes. That said, voting by mail is not and may never be a panacea. Many of the remote accessible vote-by-mail systems currently market-ready or in use by voting jurisdictions across the nation make vote-by-mail significantly more accessible, but not fully accessible. As a result, in-person voting locations must be available to the greatest extent possible and follow Center for Disease Control and other federally recommended health guidelines for COVID-19 safety. Early voting periods and hours for in-person voting must be extended for several weeks before Election Day to reduce congestion at the polls and allow for social distancing. The number of ballot marking devices or other accessible voting stations must also be significantly increased at every polling location, and voters should be allowed to vote curbside. Even in states where curbside voting is not currently allowed, its use would ease accessibility and federal compliance issues that will inevitably arise from the limited number of available polling places and unexpected relocation of polling places, as well as to allow voters at greater risk in regard to COVID-19 to limit their exposure. Many members of Congress have stepped up to propose legislation to help address these issues, including the HEROES Act and the Vote Safe Act. NDRN calls on Congress to work together to pass a bill that will address the safety issues raised around voting during this time, as well as ensuring accessibility for people with disabilities. Congress must also act now to pass the PAVA Program Inclusion Act and provide the territorial government and P&A of the Northern Mariana Islands, as well as the Native American Disability Law Center, with desperately needed HAVA funding to ensure access to the vote for Pacific Islanders and Native Americans with disabilities. Extending funding to the only 2 P&As excluded from the Protection and Advocacy for Voter Access program is a simple and no-cost legislative fix. Finally, Congress and the U.S. Department of Justice play a critical role in ensuring that elections are fair, accurate, safe, and accessible. The delicate patchwork of federal laws that protect the rights of voters with disabilities must be protected, restored, and enforced to their full capacity. We call them Americans with disabilities because they are, first and foremost, Americans, and their civil rights, as well as the health of all voters and the health of our democracy, depend on it. Thank you.
I wanted to turn for a minute to the issue of disability voting. Ms. Bishop, even under normal circumstances, without a pandemic raging, our voting systems are often inaccessible for individuals with disabilities. And I introduced the Disabilities Voting Rights Act, which was included in HR 1, to try to get our state and federal officials to invest in mail-in voting and making polling locations more accessible. Can you speak to concrete steps we should be taking to ensure that voting during this pandemic is accessible and that individuals with disabilities are not prevented from participating in the vote?
Absolutely. We talked a lot, and thank you for that question. We talked a lot today about the importance of mail-in voting as a way to keep voting safe, especially to deter congestion at the polls. And I think that's critical during COVID-19. But what we can't overlook here is even the way we describe it, mail-in voting, voting by mail. What we're essentially describing is a paper ballot that's inherently inaccessible to people with disabilities. And I think the most obvious example of that, if I were a voter who was blind and I went to my polling place and you gave me a paper ballot and a pen and you asked me to mark it privately and independently, which is my right under federal law, I can't do that. So if you mail the same ballot to my home, I don't magically regain my vision when I sit down at my kitchen table. That ballot is still inaccessible to me. We have to have options that make mail-in voting accessible to people with disabilities. Unfortunately, they exist and they've been in use for years, particularly in states that have prominent vote-by-mail systems. And honestly, any state that under the MOVE Act has to provide it for our military and our overseas voters. Electronic delivery of blank ballots and remote accessible vote-by-mail systems are making it significantly more accessible for people with disabilities to access vote by mail. It's not a quick fix. It doesn't make it fully accessible for all voters, but it does drastically improve the accessibility, which in the time of COVID-19 means that more voters will be able to opt to vote by mail and won't be forced to make that decision to go to the polls and risk their health to be able to cast their ballot. So it's critical that any states that don't currently offer electronic ballot delivery broadly to their voters expand it right now and make that an option for all voters.
Thank you. And I believe my time has expired, so I'll yield back.
Ms. Bishop, you talked about the need to have sort of a hybrid approach so that as many people as possible vote safely from their own home so that the disabled would have the ability to go in person. Can you describe for the American public why it's important to take that approach?
And it was said earlier today by another one of our witnesses, thank you for raising this issue again, that in order to really make our elections work for all voters, we have to be able to provide a broad range of options. There is no one-size-fits-all way of voting that's going to work for everyone. Neither in-person voting nor vote by mail have honestly been made fully accessible for people with disabilities at this point, despite the fact that there are several federal laws that protect that right for them. So we have to be able to provide as many options as possible for people with disabilities. If we don't make our vote by mail as accessible as possible, they are not able to choose the safety of voting from their homes, which is a privilege for those who are non-disabled. But if we don't also make our in-person options available and as safe and as accessible as possible, people for whom vote by mail just simply does not work will not be able to cast their ballots. So it's critical that we're implementing electronic ballot delivery for vote by mail, but also that we have in-person voting to the greatest extent possible. We have as many ballot marking devices or accessible voting stations as possible. The have a minimum of one machine per precinct is not sufficient, and that we're leveraging curbside voting to reduce exposure to COVID-19.
Thank you both so much. I yield back, Mr. Chairman.
Ms. Bishop, Michelle Bishop, I am in total support of expanding the opportunities for voters with disabilities. One of the things that I've seen violated is the right of the voter to come to the polls and have curbside voting. I want to ensure that that is never undermined and done safely in light of COVID-19. Help us understand how important that is. Ms. Bishop, if you would answer the importance of this, those with disabilities, but particularly the curbside voting, which I want to focus on.
Yes, thank you for that question. Curbside voting, I think, is a largely misunderstood issue. It's actually a critical stopgap measure, even outside of the context of the global pandemic. We have not yet made America's polling places fully accessible to people with disabilities. In fact, the US Government Accountability Office has studied this. Most recently in 2016, they found that in terms of architectural access to a polling place, wide enough doorways, paths of travel, accessible parking. Less than half of America's polling places were actually accessible, only 40%. And unfortunately, that 40% is actually an all-time high. So that almost half is the best we've ever done, realistically, at making all of our polling places accessible. We have to fix that. But until we can, allowing people with disabilities to vote curbside if they're not able to get into the polling place is an important way to make sure they're still able to cast their ballots. So regardless of COVID-19, curbside voting is a critical measure. I think it could
Curbside
also be really useful in the context of the pandemic as well, because it allows you to reduce your exposure or potential exposure to COVID-19. If you're
Thank
able to stay inside your vehicle, it's the same thing we see at COVID-19 testing centers that are
Ms.
primarily
Arnott,
Thank
drive-through.
you.